There could soon be fewer federal restrictions on marijuana. The Department of Health and Human Services is recommending a change in how weed is classified. National correspondent Mara Siriani explains the plan and how it could affect consumers.
Hey, this would be history making for sure. So you can already legally use recreational marijuana in more than 20 states, while 38 states have approved it for medicinal use. Despite those changes, pot, though, has remained illegal on the federal level. But now the nation's top health agency wants to ease some of those restrictions. Now, the DEA currently lists marijuana as a Schedule I drug along with heroin, LSD, and ecstasy. And currently, marijuana is listed as having a higher potential for abuse than cocaine, oxycodone, and meth, which are Schedule II. That is why the Department of Health and Human Services wants to take pot down to a Schedule III, which would put it on the same level as aspirin, cough syrup, and ketamine, which you can get a prescription for. So what changes if pot is reclassified? Well, for starters, Schedule I is reserved for drugs, again, like heroin, with no currently accepted medical use. Those drugs are also way more difficult to research for medical purposes and are often more aggressively criminalized. Now, if the DEA follows through with the change, we would likely see the booming cannabis market further expand. Additionally, a certain tax provision only applying to Schedules I and II substances would no longer apply. Now, it's no secret that marijuana legalization has increasingly gained bipartisan support over the years. This year, several states, as you see here, have seen legalization victories, including in Georgia, where if you have a medical marijuana card, you can now go into any dispensary and legally get oil. And then in Minnesota, beginning August 1st, it became legal there to possess, grow, and use certain amounts of pot for residents over the age of 21. And when it comes to reclassifying marijuana, the DEA will review the recommendation and then make a decision. It's a process that could take months. Mara Siriani, Scripps News.